Hi, Sophie. How are you doing?
I'm great. How are you, Aishwarya?
Doing
Good to
great.
see you.
Great to see you. It looks like we're matching here as well. We didn't plan it, but thank you so much for coming on. It's been, first of all, we've known each other for a while, but it's great to kind of touch base and have you on our platform at Posana. And this is our very first interview for our caregiver wellness series that we're putting together, also in celebration of National Caregiver Month, which is in November. And, the two of us have kind of talked about the importance of caregivers, and especially with your experience, both as a family caregiver and a nurse, and somebody who's been working in the nursing field for so long, and having seen, especially throughout this past several months with COVID, and how that's really impacted us. So we're excited to get your perspectives and to hear a little bit more about ways that we can help our caregiver community. So I'll read a little description and just give you a quick introduction, and you can, tell us, maybe add a little bit more to your background. So Soffy Vilson has proven leadership in various professional fields as a nurse administrator and a licensed nursing home administrator for the past 3 decades. She took her doctorate in nursing practice from Monmouth University and is currently working as a vice president of quality assurance, and oversees the post-acute care facilities. She has presented nationally at various professional and community organizations and across the USA, including the Steve Adebayo Show, Impact Nation, and State Nurses Association. Her passion is to serve the community through various organizations: the World Malayali Council, Karuna Charities, Kerala Association of New Jersey, New Jersey State Nurses Association, Organization of Nurse Leaders, and various other organizations. She's also dedicated to her loving husband, Shaji, and her 2 kids, Josh and Joyce, who are here and support her in all her activities. So thanks, Sophie, for that. And maybe you can walk us through, again, a little bit more of your background, as we can maybe start on the professional side. So a little bit more about that background for our caregivers here.
Sure. Thank you, Aishwarya. I really appreciate giving me this opportunity, especially on this platform of Posana. I really, really like the mission and the vision of the organization. So that's when you approached me, I said that is really great. Giving back to the society, giving back with what we have earned and given to us by the grace of God. So I came to this country, like you said, almost 3 decades back in 1991. Prior to that, I actually took my nursing degree back home, and I was actually a nursing instructor teaching students. I loved that job until I met my loving husband, and then this, I said, okay, let's just get married, and that's how we moved to United States. A great opportunity for us, and I think that's one thing I actually agree, it is a land of opportunity. And coming from a different world, it was a different world for me. It took me some time to adjust to the whole differences, not just cultural, but even in the nursing field, it was entirely different. So I started off in the nursing home, and also, when you first start off, one job is not enough, right? So I also had my hospital job experience also. So I always had like 2 jobs going at all times for a while, right? But the beauty of nursing in the United States is it's all more scientifically, arranged with more technology and things along that line, making nursing a little more different and unique than what I learned back home. The other thing that I learned here is if you have a passion to learn, you could go into higher studies. You're not just stuck in one area. You just keep going and going, right? So that has helped. And anybody who I have worked with, they always said, listen, you need to move higher in your education so that you learn the best practices, bring in your scientific knowledge, and you can connect that scientific knowledge to the personal and experiences that you could provide to the patients as well as other providers. So that's one thing I did. I was able to go and take my doctoral degree from Monmouth University, thanks to all my professors and my colleagues who actually helped me in doing that, because you do need a lot of support in trying as you try to go through that career ladder. So as I told you, I started off in the nursing home field, and you just fell in love with that geriatric population. They have given so much to this society, to this community in different worlds, and it's time that somebody needs to care for them. So when I felt that passion with geriatrics, I said, this is where I wanted to work, right? This is where I wanted to enjoy and practice my passion. So I continued that nursing field. And I still remember when I was working as a nurse, sometimes it's long hours in the beginning. So one of my managers came and said, you cannot just stick yourself just as a nurse. You definitely have the ability to go into management. And that's how my management career actually started. I started off as an educator and then as a director of nursing, and then went into the roles, and then right by president, all by the grace of, and thanks to all my colleagues who always supports me in creating that network. That network is very, very important as you move through the ladders in different aspects of nursing. So that's a little bit a sum of how I came to nursing. I'll tell you, I am still very, very strong in telling anybody, nursing is a profession that is very truly giving. You get a lot of satisfaction but as you give and get from your colleagues as well as your patients. It's a very rewarding kind of a profession as far as I'm looking at. And I always believe, as not just because I'm a female, I believe caring, if you don't have it true in the bottom of your heart, you will never succeed in your life. So as a nurse, you can be a caring person, a giving person, and make things better.
Yeah. Thank you so much. Yeah, that's really wonderful. And especially hearing about, your transition from India to here and seeing some of those changes, even in the educational system, but then also some of the support systems that we have. And maybe we can talk a little bit more about that support system. So, what are some of the support, what is some support that the nursing population has within these facilities? I know you've worked in the adult care area, and then also now in the nursing care facilities, and so, or skilled nursing facilities. So what are some support systems that nurses have within these organizations?
So, the support systems are always available. Trying to know the resources and tapping into the resources is the most important one. For example, in the South Asian, for example, when you look at the Indian nurses, we have Indian Nurses Associations that has been working very diligently with many of the nurses. We have also the same type for even Hispanic and Black American, we have different organizations that support the nursing. But beyond that, so those are professional organizations, but beyond that, I tell you, my telephone has almost so many contacts that because I don't delete my contacts. When I get a new phone, all my contacts gets transferred over. So in time of a need, who can be there as a resource, you never know. It could be somebody who you worked with 10 years ago, but if you are in need of something, you can always have that personal relationship with them and reach out to them. By the way, what do you do when you are faced with this kind of a challenge? Do you have a policy that you could share with me? Or would you explain to me, how did you, what did you do when you faced this thing? And so that open communication with your colleagues, doesn't matter if you're still working with them or not, you never break up those connections. That is actually a great thing you should actually, I encourage all the nurses to do, and whether in what field it is, right? Whether it is nursing or any other field, never break up your connections. You could break up the organization and go into a different organization, but that personal connections with your colleagues, you never break it. You always keep it so you could actually ask them, what can I do next? The other thing also I always say is you should actually have like that friendship network, right? Even if you don't meet often, like once in a while to call them or once in a while text them. The best thing that has happened is WhatsApp groups. There's tons of WhatsApp group happens now, right?
Especially for us Indians and the South Asians.
Right. So there's so many groups. Sometimes I'm like, oh my God, there are so many groups that I'm in now. But it is actually a good thing. It actually gives you not only professional knowledge, it gives you social background knowledge as well as personal connections. There are spiritual things that you could actually keep in connection with. To get in the morning a message like a best good morning message really turns your day into an affirmatory situation, right? You could have the worst nightmare at the nighttime and wake up with this beautiful message which turns your positive outlook for that day. So that is one thing I always tell people: do not break your connections. People might say, oh, you have so many connections, you don't have a best friend. I said, all of them are my best friends, because you know what? A friend in need is great indeed. That's how I look at it, right? So
Yeah, especially, exactly. So I think, especially for the South Asian community, that sense of, togetherness is so important. As we grow up, we see that in our families. We see that a large network is really important to us, and I think when you talk about on the professional side, having people that know what you're going through, almost, because it's hard, right? Even I guess for me, I worked for a little bit in the oncology space in some of the clinics, and it's really hard to communicate your day to somebody who's not been there and like seen that. So definitely agree. So maybe in light of COVID-19, this past year has been, so just upended everything for everyone. So many changes, obviously so many tragedies, but opportunities for us to learn and grow. How has that really affected your skilled nursing care facility, and maybe things that you've heard overall, and how has the facility itself, you know, um, stood up to that challenge and worked at it?
I think COVID-19, it was really shocking for almost everyone. Like the whole universe has been touched by this COVID-19 ball. It just came from nowhere, and we still don't know where it is going. I think we know a little bit more than when it started in either January, February, or March. I think the nursing homes actually started seeing it by March. Actually, in New Jersey, March 5th was the first case of COVID-19 that actually happened in the nursing home. So most of the nursing home, people had a totally different COVID-19 onset. You might be wondering why I'm saying that, because I don't know if you remember when COVID-19 first came on, people said there are 3 symptoms you need to look at for: respiratory distress or shortness of breath, fever, and cough. But when we looked at our population that was happening in the nursing home, guess what happened? In the morning, the person was fine, having breakfast, had a fall. We sent them out to the hospital. That's when we diagnosed that patient had COVID. We had a patient who actually was fine, had their dinner, went to bed, never woke up the next morning, had symptoms of COVID. So those symptoms of shortness of breath, fever, and cough is diminished in the nursing home residents. One, because their body temperature, our 100-degree may not be their 100-degree. They have a weaker immune system and their body systems react to the fever, or at the infection in a different way. They may not be able to cough, because of their weak respiratory muscles. So we may not hear their cough as a symptom. The other thing was the shortness of breath. They probably may not be able to tell you. So those subtle side effects of COVID took many, many lives of the nursing home patients. The second thing we were challenged was we didn't have the testing supplies at that time because COVID was not an expected thing, so we didn't have the testing supply. The third thing was, and by the way, the testing supplies, so by the time we do a testing or send the patient out, it's too late in the game because by the time it is too late. Yep. The other struggle was also we didn't have enough PPE to protect our healthcare workers. In the beginning, there was no N95 mask for COVID-19. And as a matter of fact, by the time we figured out how we can even get the N95, COVID has become an outbreak. So a lot and lots of challenges. And we also not only have the patients affected, we also had our caregivers affected. Many of them got sick. So now, not only they are sick, you don't have enough staff even to take care of our residents who are now sick. So, thank goodness, there is New Jersey and CMS actually decided you don't need to have a CNA license in order to care. So we provided the aspect of a universal healthcare worker. People were trained, let's do these things, and this is what you do to take care of the bare necessities of the elderly people. So those aspects were done, but it was a struggle. But I really salute the nursing heroes, the paramedics, the healthcare workers who stood beyond their 8 hours of work. They continuously work to make sure that they're doing the best of their best for the caring of these residents. Not only in the nursing home, I think it is seen all across the United States and all over the world. They are relentlessly working, and even the scientists, they're relentlessly working to, how we can attack this COVID-19 in the best way so that we do not lose one more life to COVID-19. So whether it is a COVID vaccine, whether it is something else we can do, we're all trying to do the best. But in the meantime, we have to live with it. It is a new normal for us. So the things that we need to do, whether it is as simple as, when I go, I try not to go out to the stores much, but when I see somebody, even though I feel like I'm afraid, but if I don't see them with a mask, I tell them, hey, how to wear a mask. Pull your mask up over the nose so that, people have a tendency, because it is required to wear a mask, they will put something on, but it's under their nose. It's just covering their,
That's actually quite interesting. So I've seen that quite a bit, and a little bit of an aside, but how do you kind of navigate that conversation with somebody who you don't know and are
I know. It does need a little bit of a gut, I think, because sometimes my kids actually say, Mom, why do you bother? Because I do care, so I just say, hey, just pull up your, face mask a little bit up, because it will protect you and protect others, right? Because if you don't do it, others are not going to do it. And that's the protection for, from COVID for others. We can control it. So it's a little bit of moving it up. That's all it is. So, sometimes I'm afraid to talk to people, but most of the time I try to do that. I tell you another example. When I go to the park also, people, there's the signs in the park. You just go one way, right? People just don't look at the sign. They come the opposite way. So I'm like, sometimes I have my little dog with me, so I'll tell them, by the way, there's a one-way sign. It's the other way you're walking. Right. So some people look at me like I have 10 heads, but it's just driving them to the right way.
And your due diligence for public health and all of that. So totally agree with what you said before about, the sacrifice and the blood, sweat, and tears that all of our healthcare workers have been putting in and continue to put in. How have in the midst of all of this sort of stress, right? I can't imagine the sort of mental and physical stress that they would be under. Um, how have they, as far as you know, how do they really keep their own health up and their own sort of spirits up, their mental health? What are some things that the healthcare workers are doing to really keep them going?
You know, that's a very great point, Aishwarya. I think often nurses and healthcare workers, they don't put themselves as first. They put others as first. And, you know, we have a lot of people who are now suffering from post-traumatic disorders, PTSD. There are people who are going into depression. And the after effects of not taking care of themselves and taking care of others, because you're short, so you don't want the building to be short. So what do? You work double, or you might have to finish up certain things so that the next day can move on. So you do, you know, extra hours and reduce your hours of sleep. It has taken a toll. Lots of organizations have done a lot, you know, to give caregivers break. Like, you know, they will say, take a break during your shift, or, you know, free meals, and trying to encourage them with like spa and things along that line. But again, I strongly believe that self-care has to be each person's priority. Everybody can tell you, do this, listen to music, do yoga, but we have to make sure that if we do not take care of ourselves, we cannot take care of others. You know, one of the things I always remember is when you get on the airplane, you know, they tell you in case of an emergency, you first have to put your oxygen mask on, right? You don't try to put your child's or somebody else's. You put yours first, and then you can save others' life. So that same philosophy has to be for each of the healthcare providers. Even if it is simple things of self-care, such as, okay, let's look at the different aspects of physical health, right? You know, rather than trying to not eat, take like a 5-minute break or something and try to eat, or, you know, so that, and stop eating junk foods and eat like with protein. So it, you know what I mean? It's going to give you the right energy. Trying to drink water, trying to walk, trying to balance life is very important for your physical life. Looking at your emotional, right? Find out a friend who you could talk to, right? It could be stressful day, but if you get like, you know, 5 minutes of time to just say, how was your day? Let's talk about something, you know, that connection with your friend or your loved one, whoever you wanted to. Or even if that is not possible, if you have a pet, take the pet out for a walk for 5 minutes or 10 minutes. Connect to the nature, you know, so that simple things of taking care of yourself emotionally is very, very important. The other thing is, you know, when I was in the COVID time, I wanted to learn everything, you know, what's going on, what is the next thing to do, you know, hey, what is it, you know, so I was constantly on this media, you know, TV or whatever, trying to hear. And that negative news, if you continuously hear it, I'm telling you honestly, it really brings you down. Yes, you want to be updated with the news, but if you're constantly hearing it, it's always negative, negative, negative. You need to sometimes shut it off so that at least give like a half an hour before your sleep where you are not listening to anything. Just shut your eyes. Just shut your eyes and then go to sleep. That will give your body the rest that you need without having all these associations with the media. So physical health, your emotional health, your mental health. And if you feel like there is something frustrating, you know, or something bothering you, don't keep it to yourself.
Yep.
You know, if you cannot even talk it to somebody, just go to the bathroom, talk to the bathroom wall. Just talk as if there is somebody there, or look in the mirror and talk, because that releases your emotional tension and your anxiety, so that buildup is not happening. When you have the buildup, you result in high intensity anxiety, stress, and emotional disorders, and the after effects is you're going to pay for it.
Yep.
So that's what I wanted to tell healthcare givers, you know, yes, we are giving people, but also you cannot give until you take care of yourself.
Absolutely. Yeah. And I think what you were talking about, the news scrolling, I think there's a term now called doom scrolling, where you're just, you're seeing just negative, negative, negative. And it's probably affected the broad population, even outside of the caregivers. So yeah, thank you so much. So this was really helpful to understand the perspective of the nurses, and even understanding some of that nuances with how COVID really affected the different facilities. I know that you yourself have been a home caregiver for your family. So would you mind telling us a little bit about that?
Sure. That is really was an eye-opening experience for me, because as I told you, I've been in this nursing field. So my mom was with me. She actually came to this country maybe in 1996. So she was my sole support as I went through my education, my child rearing. You know how Indians are, right? You know what I mean? Like, South Asian community, not just Indian, South Asian people, they're all caring and loving each other, and that tight relationship with the family is very, very significant. So my mom treated me as if, I'm always her child. You know what I mean? I can never grow up. So it was a great experience. So, and then, this disaster of one of the physical/emotional health affected my mom too, which is now known as dementia or Alzheimer's, or however you want to call it. Because I think that's a disease that is not only affecting the patient, but it affects the caregivers. So it started off with my mom, as she was like forgetting where she took off her, her ornaments. She loved, wearing ornaments. So, and she cannot find it. And we used to have somebody who come and clean our houses, clean our house. So she was like, oh, maybe she took it, So it's like, we know that was not it. So then we will find it under her bed. Like she will wrap it in a tissue paper and she'll put it under her mattress, because she's trying to keep it safe. But she forgot that where she kept it safe. That was her initial onset of the disease. And as the disease was progressing, she started losing her recent memory. She could remember her, the previous, whatever happened in her life. Everything was very clear, her prayers, everything, you would not even know that she had any type of a disease. The only thing that was is she was recent memory was going. And then when that was happening, sometimes, she would, turn on the oven and forget that it was turned on, and there was gas leaks and whatsoever. So it was getting like to the point of her own personal safety and, safety of us. Even though she said, no, I didn't turn it on. You probably did, because in her mind, she didn't, and you can't blame her. So you're caught in the middle, like, hey, she's my mom. You can't say anything negative. So trying to make sure that, okay, it's all right, let's just turn it off now and, move on. So what I was trying to look for was a support system to see, how can from this Alzheimer's/dementia, what can I do? So all of the caregivers support, there's Alzheimer's Association and organizations that is available. The struggle that I went through, even when I was trying to get a caregiver for my mom, is nobody spoke her language. So she came to this country and she learned English. But guess what? When this dementia was hitting her, the first thing she forgot is anything that she learned recently, which was English. So she could not understand a thing she was trying, anybody was trying to say in English. She reverted back to her South Asian language. I could not get one caregiver who spoke that language. I could get all other languages like Gujarati and Hindi, but we could not get anybody who spoke her mother tongue. So when I put her, when I went to work, I was trying to put her into an adult day where a few hours she will stay there. So she'll be mingling with others. And then when I come home, I'll pick her up like an adult daycare. It did not work out, because when they spoke other languages, she thought they are cursing her out. It was too unfortunate. So I took her to to her doctor, and I explained, these are the struggles. What does you suggest? And her suggestion was, she is remembering the past, and she's remembering what she went, lived. Maybe it's a good idea to take her back to India, with very, very reluctant. But my sisters was very, very supportive. They're like, listen, Sophie, this is the time, she needs to enjoy what she actually remembers. So I took her back. It was 4 years ago. I'm telling you what a difference it made when she was, because here our 6 months that that we have here, we cannot go out and all, but back there, she could still connect with nature every day, connecting back to that nature, trying to see people, having that emotional relationship with others, hearing her own emotional mother tongue made a big, big difference. So for the people who are living here, who are faced with that, maybe does not have an opportunity to go back, and maybe they don't have caregivers there in the motherland where they live. So what I actually was thinking is, anybody who can speak different languages, and if we could create like caregivers of the South Asian communities, like, based upon the mother tongue. I never thought about it before, but when it actually hit me, that's when I realized the importance of having that kind of a deep dive to make sure that we, that's the only way you can connect to them. You know what I mean? That's the only, so if you don't, you could have all the things in the world, but if they don't understand you, like, the touch is there, you could see everything, but at the same token, if you cannot hear, what you want to hear, it's tough.
Yep. And definitely the level of comfort and, it's so different. And I think sometimes we take it for granted because we're here, everybody kind of speaks English, so we don't really notice it as much, but it's such a different level when you have somebody that's of the same culture, speaks the same language. And I think that really separates um, the South Asian community and different cultural communities, because we have this sort of love language almost, which is like our mother tongue, that is that comforts us, right?
Yes, yeah.
And it's kind of sad because you would think in New Jersey it's such a diverse area, and then not being able to find someone who speaks Malayalam, right? Malayalam.
Right. Yeah. It might be easier now. It wasn't 4 years ago,
Yeah.
right? You know what I mean? Now we probably, but the other thing is trying to see most of our population, they're highly educated, and for people to give back and go into the level of that caregiver and that aspect is very tough.
We, just finished talking about uh, the language barrier that you faced with, caring for your mom. One thing, especially in talking about your decision and the many factors that went into um, making the decision to send your mom to India so that she could get her care. And I'm so glad that it ended up being a positive experience for her. But during that time of decision making, what was going through your mind? How were you feeling during that time?
I mean, actually, it was honestly a very, very difficult decision. I had to actually look at it. What are the pros and cons? And when I was looking and I'm putting like, okay, these are the pluses, these are the minuses. And then you have some people who actually will give you a little bit guilt, like, why are you doing to your mom? She's in a beautiful country here. Why are you sending her back to India? Right? And that guilt feeling actually really eats you down. Then I looked at it and said, you know what? I should not look at who is talking. I should not look at what is the benefit for me. I should only look at, is it going to benefit my mom? And when I looked at that angle, what would she get? What are the benefits physically, emotionally? So in order for me to take care of my mom, if I was not working, yes, I could have been with her 24/7 and she would have gotten the best care, but still only for 6 months because she cannot go out. Only 6 months, she just internal because she loves nature. She likes walking. That's what, her enjoyment was back home. She was a very, very, um, she likes to walk and, talk to people and connect to everybody. She even used to talk to strangers, you know what I mean? That was her personality. So even if I keep her here, I can only do it probably max 6 months here, right?
Mhm.
That was one thing. Limited amount of people that you could connect, especially when you are working. So I said, and then plus her churches that she used to go back home, she went more religious as she was having these dementia attacks. Everything was like more into God and chanting and religious services is what she was craving for. So more pluses from the side of a person-centered care. So when I looked at my mom as the person, when everything revolved around what is it good for her, it was easy for me to make that decision. So to this time, that's what was motivating me. Is she going to benefit? I took out everybody else from that picture. It was just her because she's the one who has the dementia. What can I do to help her? That made me to have a clear conscience when I took that decision myself.
Right. Thank you so much. Yeah, and I can't imagine the emotions that went through your mind. And sometimes, having that clarity, because we mentioned before, South Asian culture is very, you have your large network and there's a lot of people. With that comes a lot of opinions, right? So people have
True,
something to
true.
say. So, focusing on what was really the most important for your mom.
And I have to add one more thing, because when you talked about network, you will have some people who always probably could blame or whatever, but you have a lot of people, especially when my mom was here. She was here almost 15, 16 years with me. I took her everywhere I went. It was like, like a baby in the bag kind of a thing. You know what I mean? Like, she was with me everywhere. We never went anywhere without her, so everybody knew who my mother was. Every organization knew who my mother was because if I went for a nursing association meeting, my mother was with me because she wanted to be with me. So that openness, when we go to Florida, even if in Disneyland, my mother is with me. She will get on rides, you know what I mean, whether she's capable or not, because she wanted to have that connection. She wanted to enjoy life. She enjoyed her life a lot. So there was a lot of those network people, like my personal friends. They said, listen, you gave the best of the best to your mom while you can. Now you wanted to give the best what she can in wherever she's going to be. So that's what also made it, there are going to be, like you said, Aishwarya, there are going to be some people who will look at, oh, maybe she doesn't want to take care of her mother. That's why she wanted to take her back. No, that was not the intent. The intent is, where can she get the best services that she deserves?
Yeah.
She deserves the best. And that's what helped me to have that decision.
Yeah. No, that's wonderful. And so as we, thank you so much for talking through so many different areas of caregiving, all the way from the nursing space, the challenges that, the entire world has gone through in the last 7 months or so, and also your own caregiving experience. It was a lovely story, and thank you so much for sharing with me and with our community at Posana. So as we kind of conclude our session interview here, what are some kind of, if you had to give like 3 overarching tips for our caregivers, for both the healthcare professionals as well as the informal workers, what are some of the things that you would say to them to really focus on when it comes to their self-care?
The most important thing COVID has taught us, this is a new normal. It may be, it's for a temporary period of time if we could get a COVID vaccine or however, but this is a new normal, new way of life. We used to talk to people, smile, look at their smile, look at their reactions, right? You know what I mean? That's how we communicated. Now, it's now hidden, right? It's through our mask that we communicate mostly through our eyes. And now people say, like, you know what I mean? Are you angry? I'm looking at your eyes because I can't see anything else, right? So as we move through this new normal, I think we have to accept it. If we accept and we understand and we stick to ourselves and say, I have to change my patterns and behaviors to accommodate to the new normal. You know, in the olden times when computers came, everybody thought everybody is going to lose jobs and you can never come, you know, go into that world. Well, we all went through that world. Now it is our normal, right? Same way, COVID has hit us. It is a new normal. We can get through it. The most important thing is acceptance of that new normal. Making sure, yes, this mask is going to be there for a while. I have to. I have to have hand hygiene. I have to practice social distancing. Those are the things we needed to accept. Once we accept it, we will, you know, do better. We also have to create healthy habits, including these healthy habits is this masking, hand hygiene, which we probably should have done a long time ago. You know what I mean? Infections has been increasing. We keep increasing our antibiotics rather than trying to go back into the basic principles of infection control and hand hygiene. One thing nursing homes has learned, nursing homes are getting a lot of benefits now from the federals. Before it was a forgotten world. Guess what? It's now the topmost thing for feds. Everything is now going into the nursing home. Sometimes I believe COVID-19 has opened up the opportunities for nursing homes because now they can get infection preventionists, they could get more education, they can get more N95. So that's the plus sign, but we lost a lot of lives to get that plus. You know, had we have looked at this, you know, scientifically before, we probably could have prevented a lot of things utilizing infection control. So back to sticking to healthy habits is the most important thing. Hand hygiene, protecting ourselves, washing hands. We don't have to shake hand and hug all the time. You know, the Indian community back home, you know, I didn't learn that hugging and kissing and all this until I came here, right? We were still a very good personal relationship was maintained, you know, by still in a different way, right? So it is a new normal. That's all I'm going to say. Maybe we could come back. Yes, it is an intimate relationship of, you know what I mean, hugging and, you know, all. But until this COVID is gone, we have to accommodate to the new normal. The other thing is we have to reach out to our support networks, whether it is your personal friend, whether it's your professional friend. Keep your network healthy. That support system, you never know. You could have all your friends, but they might be miles and miles away. If you have a friend who is your neighbor, guess what? He could go to ShopRite and get you what you need when you have COVID or some kind of an illness. So creating that network inside and outside is very, very important. You cannot be selfish, right? You have to figure out a way to help others. If you only think about yourself and you never help others, guess what? When you are in time of a need, you're not going to get enough help at that time. So figure out ways to give back, even if it is in small quantities or small ways, or even picking up a phone and talking to somebody who is isolated or who has COVID. That's what sometimes I do when I hear like one of our church friends or somebody has COVID, or, you know, I call them. Why? Just to give them that support. You know, I may not be financially able to help, but a few minutes of talk gives a good mental health for that person who is on the other side. So figuring out ways to help others will bring back positive energy to you and positive things to you. So that's another thing. And emotionally, if you wanted to keep a record for yourself, keep an emotional record, you know, of, you know, how do you feel? How did your day go? If you feel like your day was a lot of negative things have happened, and you write it out, you could actually think back and say, okay, so tomorrow, instead of having those negative things, how could I make that into a positive thing? So that journal is an old school, but, you know, maybe you could use your tablet or your iPhone or our technology can take you, but jotting it down makes you to think, how can I overcome that? And that would help you to relieve the stress to go into with a positive energy into this new normal. I mean, those are some few, and then either what relaxes you, such as like, whether it is a music or an outdoor walk or, reading a book or reading a Bible or chanting some, prayers, whatever it is that relaxes you for a few minutes, do it. Do not make that as a practice, make it as your routine. And don't forget your body. You don't have a good body, let me tell you, you cannot do much good. So take care of yourself. That self-care is very, very important. Does that make sense?
Absolutely. Yeah, no, and it seems there's a lot to do with that mindset aspect, right? Really thinking about this is a situation, like you said, kind of having that acceptance and then focusing on where the areas both outside of myself and within myself that I can really nourish and nurture to keep myself going to be able to then care for other people, right?
Absolutely. Yeah, absolutely.
Great. Sophie, it was so wonderful, first of all, just talking to you and seeing your face. But, we've learned so much, I think, of a broad range of topics and had a wonderful discussion with you. So I just want to thank you for all of your time. As we conclude, we had a couple of questions from our team. So I'll have you answer just one question from one of our team members, Brandy. So Brandy, whenever you're ready, feel free to ask your question to Sophie.
Sure. Sophie, thank you again so much. I just want to echo the appreciation that we have for your insight and wisdom that you have shared with us today. The question I have focuses around the senior facility community. As someone who has a grandparent in a senior facility, what is the best way that we could go about supporting not just them, especially during COVID-19, but more so the healthcare workers that are tasked with being there day in and day out, providing the level of support that, say, a daughter or a granddaughter might normally be providing for their loved one?
Thank you, Brandy. It's a very, very important questions. And actually, especially for COVID-19, it is tough. It is tough not only for the residents, it is tough for the caregivers as a family member. It's very tough not to see what's going on. There are family members who used to come every meal to see their loved one, to spend time with them. Because of this lockdown, they are not able to. It is difficult. It's very, very difficult. I tell you, it is also difficult for the caregivers also, because they actually see the changes in the patient while they are not able to see their family member. Some of them expresses verbally, some of them expresses emotionally, and some of them non-verbally expresses. That's the difficult one, which I'll tell you in a minute. For example, for patients with a dementia, they cannot tell you, hey, I want to see my daughter. What can I do? Instead of saying that, they might be hitting someone, or they're screaming, or they're yelling because they're not able to express themselves with that dementia, that I wanted to see someone who I love. A couple of things that we should remember is it is very hard to go through this, but we have to trust the nursing home or the skilled nursing facility where our loved one is. This is, again, a new normal that we are going through. If we have any questions, there are very, very, very different ways that each nursing homes are doing. Some of them have like daily communications that is happening, whether it is via telephone, like, they will say, hey, we have so many COVID cases, this is what is going on, or this is what your parents have done today. Those kinds of day-to-day communication with the family members is happening in some of the nursing homes. There are other things which is known as interdisciplinary care team meetings that is happening via Google Meet. Sometimes it is through FaceTime, sometimes it is through Zoom. So they will arrange for you to have specified period of time. There you actually can ask questions, find out what is going on with your family members. Some nursing homes have very advanced technology where you could actually connect with your caregiver via social media, and you could actually see, and talk to them and figure out what's going on with your loved one. The other most important thing is whether we can or not. Again, when I was making the decision regarding my mom, what does my mom or grandma need while she is going through this difficult time? So what was the best thing she liked, that maybe I could provide it, whether it is music, something that would emotionally help her to, her hearing. What is something that she can touch and feel me, that so that she will remember me even if I'm not there. Is there a smell that she liked? Whether it is a plant or some kind of a spice, or what was the best smell that she probably liked. So the different sense organs that you could think of, something to touch that will remind me, something smell, something hearing, or a book, or FaceTiming, whatever ways you could make that your loved one to make sure that the connectedness is there for the family member at all times will be very, very significant. Because now flu season is coming. We don't know if it's going to be another COVID-19 surge is going to happen. If that is going to happen, Brandy, it is going to be a long haul, because fall is not something they predict for COVID-19 to be the best time to survive, right? So not only pneumonia hits due to flu and other things, it also, most illnesses hibernate for the full time, and it actually makes elderly more vulnerable to infections. Actually, if you look at the statistics, you could actually see the fall months and winter months is when we lose a lot of our nursing home residents. So connecting back to them, understanding what do they need and what ways we can help them is very, very important. As I touched on the flu, if your parents, your grandparents, your loved ones did not have the flu vaccine, if you have not taken flu vaccine before, this is your 1 year you need to take your flu vaccine. Because if you get flu and COVID-19 at the same time, it's not going to be easy to get out of it. So please, as healthcare workers or even non-healthcare workers, if you did not take your flu shot this year, please take it. I'm not saying it just for for the flu vaccine companies or anything. I'm just saying it for our own benefit. We need to take care of ourselves, and we don't have much other weapons to fight against these illnesses that is happening. Does that make sense, Brandy? Is there anything else I could add on to if you have any question?
No, that makes perfect sense. Thank you.
All right, I appreciate it.
Thanks so much, Brandy. And thank you again, Sophie. Again, lovely to see you. And we'll, let me actually just pause the recording. So I think
can I say one ending comment for that?
Of course, please.
I just wanted to take this opportunity to thank you, Aishwarya. I have known you a couple of years, and Brandy, Prasanna, I am telling you, this is a great organization. Your vision and mission is amazing. Let's give back to the community, whoever we can support, whatever resources we can provide to them, whether it is emotional health, whether it is mental health, because there's a lot of aspects of mental health that is hidden, that is affecting South Asians, that most people are not comfortable in talking, and this is our opportunity to help them, to support them. Giving back is very, very important. I really wanted to thank you both and the organization for having me today, and listening to me, taking the time. I'll be more than happy to help you in any ways in providing any support. Let's have more providers who are willing to join this and give back to the community. And again, best of luck in all the endeavors you guys do.
Thank you so much, Brandy. Sophie. Thank you so much, Sophie. And again, Brandy as well. So, we are lucky to have people that are as invested as we are, and who, this is such a immersive sort of experience, the caregiving experience. Even whether you are a caregiver or a caregiver, it affects all of us. And I agree, it's time for us to give back to that particular population that gives so much to us. So really appreciate you, Sophie. Thank you so much.
Thank you. Thank you so much.